Hello, I am Dr. P.T. Thomas for Unimas. We'll show you how to examine the 9th and 10th cranial nerves. As you know, the function of the 9th and 10th cannot be separated. 9th and 10th both have got sensory as well as motor function as well as parasympathetic functions. So the 10th has got the 9th also has got the sense of taste at the posterior part of the tongue. So of course these things we may not be testing accurately, but the main thing is whether the patient has any difficulty in swallowing. So that is called dysphagia. And if the palate is paralyzed, the patient also can have a nasal intonation. That means when you speak, the sound comes through the nose. When you try to swallow, the drink or the food can also come out through the nose. That is called nasal regurgitation. So if the patient doesn't have any of these symptoms, you don't need to do much of the testing. But if you really want to test, you can look at the palate, the soft palate. So shine a torch and look at the palate. Normally you can see the arching of the palate when the patient says ah. So you have to ask the patient to say ah, and you can watch the palate arching. And the uvula will be pulled to the side of the normal side, which is arching. And if one side is paralyzed, the uvula will be moving away from that side. Okay, so you ask the patient to open the mouth and shine the torch. And can you say ah?
Ah.
Yeah, so you can see the palate, both sides arching, and also the uvula. So if there is no problem, then that means the 9th and 10th are functioning normally. The 10th nerve also supplies the vocal cords, and if it is paralyzed, the patient will have a hoarseness of voice or the loss of voice or dysphonia. And if you really want to test the 9th, the 9th is a mixed nerve, that one muscle as well as the sensations at the posterior part of the oropharynx as well as the sensation of the tongue. And then the sense of taste at the posterior part of the 1/3 of the tongue. So these things need, just like the facial nerve, you need preparations to test. If you want to do the gag reflex, you have to use a swab stick, long stick with the cotton swab, and ask the patient to open the mouth. You depress the tongue, then you touch either side of the or the pharynx, the posterior part of the pharynx. Then there will be gagging. So you have to do it both sides separately. Then the other test you can do is called the swallowing test, which is usually done in a hospital. Any case of stroke, you have to test this before you let the patient feed orally. So you just take a teaspoon of water, clean water, or a saline or something, ask the patient to swallow. So if there is problem swallowing, there will be choking and coughing. So if that is there, you are not supposed to feed the patient orally. And then you usually use the nasogastric tube. So that's about the 9th and 10th. Thank you.